Now, this graphic shows the natural course of multiple myeloma. And so often, myeloma actually arises from an asymptomatic precursor condition. Dr. Kishtagari was talking about clonal hematopoiesis or CHIP being a precursor condition. And in the case of myeloma, that is MGUS or monoclonal gammopathy of undetermined significance. And again, this is an asymptomatic precursor disease, which is characterized by a low tumor burden. So the M protein, the protein amount that's produced by the myeloma, is low, less than 3 grams per deciliter. And the percentage of plasma cells that are abnormal in the bone marrow are less than 10%. So not a lot of protein or disease in the bone marrow. The risk of progression to symptomatic myeloma is about 1% per year in the MGUS population, so relatively low, but should be tracked over time. Once the tumor burden crosses a certain threshold, so an M protein of more than 3 or bone marrow plasma cells of between 10 and 60%, we call that smoldering multiple myeloma, which is abbreviated here with SMM. And in those patients, because the disease burden is higher, there is a higher risk of progression to symptomatic myeloma. That percentage is about 10% per year in the first 5 years of a patient's smoldering diagnosis, 3% per year for the next 5 years, and then 1% per year thereafter. And so really what that means is the longer that patients have stability of their protein levels and their disease with smoldering myeloma, the less likely it is to progress to active disease. Not everyone progresses to active myeloma that has symptoms, but it is something that we watch carefully for because we don't want to end up with any of those complications like bone fractures or kidney dysfunction. Symptomatic myeloma is diagnosed when patients develop one of those myeloma defining events, which are the CRAB criteria, or if they have greater than 60% disease in their bone marrow or significantly elevated light chain. So if that protein level, the light chain level gets above a certain point, then that's also consistent with myeloma that requires treatment. And we'll talk about what we use for treatment in a minute, but the goal is to really bring those levels of disease down to negative, down to 0 if we can, into a remission. Unfortunately, at this time, we're not considering myeloma a curable disease. Now, that may not be true for some individuals. It may actually be curable. But in most cases, the disease tends to come back, even if we achieve a remission at first. So then if the disease starts to come back up with an increasing number of those plasma cells and an increase in the protein level, we change the treatment that we use to try to bring the disease back down into a second remission. And if it comes back again, we do the same. And so the remissions tend to get shorter with time, although that's changing now in the era of sort of modern immunotherapies.